Well, many Oklahomans struggle with depression. Of course, it's normal to feel a little overwhelmed some of the times, but there are tools that are out there that can help you out. The CDC says the depression rate in Oklahoma was higher than the national average 2 years ago in 2019. And since October is Depression Awareness Month, Dr. Stevan Lahr from Family and Children's Services is joining us now to talk about some common myths when it comes to depression. So thank you for being here with this timely topic. A lot of people out there think depression is just, feeling sad and a little down, and they'll say, it'll just go away on its own, but it's much more than that.
Right. So depression is very different from sadness. Sadness is a normal reaction to loss. It's a normal emotion, where depression is a biological disorder that causes dysfunction in a person's life. It affects not just mood, but memory, appetite, feeling good about yourself, your self-esteem, so many different areas, but they're definitely different.
Okay, and there's another myth that I was telling you, I had never actually heard of this one, but it's that only women get depressed. Right. What is the stigma there regarding men and depression?
Society tells us not to talk about our emotions as men, right? And so there's this belief that maybe since we don't talk about our emotions, that we don't get depressed. But unfortunately, the statistic in the United States is that men are 4 times more likely to die by suicide than women. And depression is the #1 risk factor for suicide. So definitely men can get depressed. It affects everyone.
And do a lot of them think that they just can't go in to see this because they feel a little self-conscious about that? Is that
right?
Popular?
So not having good self-awareness, or just not wanting to talk about your feelings, or that belief like, oh, this is going to pass, or this is normal.
Okay. And then medication, that is one way that we can treat depression, but that's not necessarily going to work for everybody out there. Right. What are some other treatment options?
Sure. So depression, like any disorder, has varying degrees of severity and lots of different treatments. So therapy and medication. Sometimes really severe cases, we have to go into the hospital. So there's a whole range of different treatment options out there, not just medication. So one, yes, there's help. So if don't avoid treatment because you don't think there's help, and then don't avoid treatment because you think you might have to take a medication, come talk to us and we can give you your options.
And if someone thinks they are dealing with depression, how do they go about seeking any kind of help?
Sure. So there's lots of different avenues. So going to your primary care doctor and talking about it. You can call our COPES line, 918-744-4800. Therapists will answer the phone anytime, or reach out to any of the behavioral health centers in Tulsa and talk to someone.
And this can be a recurring thing too. You can have depression more than once in your life.
That's correct.
Right?
So about 50% of people after their first episode will have a reoccurrence within about 2 years of that episode. About
how long do episodes last, or is that really just kind of dependent person to person?
It really does depend, but if with treatment, it should only last a few months. Okay. But you have chronic depression that can go on past that time.
Okay. Dr. Lahr, thank you so much again.
No problem.
If you're watching right now and are struggling with mental health yourself, resources, like we said, they're available. Here are just a few of the organizations out there, including Family and Children's Services, that are standing by to help. We're going to take a quick break and be right back after this. Stick with us.